Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for October 15th, 2021. Our website is falmouthma.gov, and it gives you updated COVID information. The Health Department's email is health@falmouthma.gov, and our phone number is 508-495-7485. So we hit the 2,000 mark, 2,002 cases of COVID since the beginning, which was March 19th of 2020. I'll talk about the cases in a minute. There have been 48 confirmed cases during the day, sort of. I'll explain that in a second. During the period ending October 14th, 9 probable. Our incidence rate did go up from 10.8 to 14.4, still in the moderate category, and our positivity is still low, 2.88, but up 2.02 from last week. And the reason why I want to say it is, you see that we were at 17 last week and 48 this week. The way we get cases when the state gets it dumped into the Maven system. I think 17 was a bit low because right after I had posted the number and did the FCTV, we had some cases come from the previous weekend. So I think the better way to look at it, it's more like we were 25 and 40, still an increase, not quite as severe. I just think 17 was a little low from what the case count was, just because after we did this, I noticed some cases coming in and they were from, earlier in that week. And that does happen on occasion. It was just a little bit more than we usually. So it's from 17 to 48 is because I pull the case count at the same time every day. But when I went into the case counts, because when I was looking at it, it seemed a little bit higher. It was because the way we cut I cut the number off the same every week. I think the number's a little bit flatter than the spike. I think the last week's number should have been a little higher just because the data, it's when we get the cases. And sometimes cases come in after they've been transferred from a couple of towns, or they could have been just a delay in the reporting by the laboratory or something. That I think 17 was a little low for us last week and 48 is a little high for us, but they are cases nonetheless. It's just, I just want to point that out. We're definitely higher this week. It's just wanted to say that it's probably not quite as a higher spike as that. I think looking at like August and September, we're right around 30, and then we had 3 weeks where we were definitely higher, much, much higher, and we've come down. I don't think we've come down as far as that second to the last dot is. I think we're going to be more in that 30 to 40 range is probably more accurate of where we are. When I get into the state numbers, you see the state's pretty flat around 1,500. The county's been relatively stable. I think that's sort of our numbers around that 30 to 40 mark, I think is going to be more indicative of kind of where we are. But again, that's just the way the cookie had crumbled on that particular day where I pulled the numbers off. So, but anyway, our case count did hit 2,000, which is unfortunate, but that's where we're at. The flatter the line looks and the closer the dots are together, the better we're doing as far as this is the flattening of the curve. We don't really talk much about them anymore, but we need to get the cases to stay flat. That'll help us and keep the counts down. It just shows the different the different places we've had spikes, the January, this past year, the April, the one we had another one again when Delta hit ours. We need to, the better we do, the flatter this line looks and the closer the dots are together. County numbers, you can see that they also were up in that sort of late August, early September, and they've sort of flattened out, maybe a little bit of an increase over the last week or so. They're sort of the same. Well, obviously our numbers do count towards this, but I think it's pretty much been kind of similar. Some towns have getting a little bit more than others, and there's like an ebb and flow to this. There's not relatively, it's not the same count every week, obviously, but there's a little bit of ebb and flow to it. Hospitalizations look good this past week, 1 and 1. And we were 6 and 0 and 5 and 1 the week before that. 1 being in the hospital, 1 being in the ICU. This isn't new cases every week. This might be the same individual who could have been there for a couple of weeks. But for this particular week, we definitely looked better, at least here, higher at Cape Cod. They were 12 and 1. But at Falmouth Hospital, they were 1 and 1. So not at surge capacity or anything of that nature. That's kind of just where the cases are. Statewide, again, it's been relatively flat. Percent positivity has been between like 1.8 and 2.05-ish over the last month or so, right around 1,500 cases the last week or two. If you look at, you see the flatness, sort of the hospitalizations are on a slight downward trend. Deaths have been a little bit down, but relatively flat. Positivity has been very flat as well. Case counts show that they're coming down a bit. I think we're sort of leveling off at some number. Again, for us, I think it's somewhere around 30 is what I've just at least been seeing since Delta and what our vaccination rates are. As far as incidence rates by county, you can see we're sort of middle of the road. So, this particular week, Dennis and Wellfleet have had issues. And, the couple weeks prior, we were close to 30, right around that, high 20s and 30. And now we're at 14. So we're sort of middle of the road for our peers. Some towns are doing better this particular week. Why? Well, sometimes there's clusters. There's things like nursing homes and stuff like this. With us, there was one particular church that had a few cases. But generally, most of our cases have been individuals and then family members within that individual. And sometimes things happen in particular towns that I wouldn't necessarily know what's going on unless it affected us, that drives some of the numbers to do that sort of ebb and flow. Percent positivity, I think we're also in the middle, so 2.88. Again, Dennis and Wellfleet have been struggling over the last, Wellfleet I know for the last couple weeks. And so for us, our positivity is sort of, in the middle of what our peers are doing. In terms of COVID, among fully vaccinated, there's been 44,498 breakthrough cases of COVID through vaccinated people, 3.21 hospitalization, or 1,428, and death of less than 1%, or 0.77 of the 44,498 cases. And this chart just tells us that, and this number's been relatively the same. It's been in threes, low threes, and 0.68 to 0.8, somewhere in that range. So it does show that the vaccines work. These numbers would definitely be higher for hospitalizations. It would be a much higher number than 3%, and also death rate. So it does show that the vaccines do work, and so we do encourage, of course, that you do that. And on the far right column, it just says of all vaccinated people, less than 1%, so 0.9%, 0.95%, or less than 1% of all vaccinated individuals have gotten COVID. That's a low number. And 3 in 1,000, or 0.03%, have been hospitalized of those who have been vaccinated. And deaths have been 0.007% of all vaccinated people. So again, vaccines definitely work. Our vaccination rate throughout the counties is pretty stable at 73%. Townwide, we've gained 154 doses in the 7-day period. We had a better week last week. We did about 250. About 90% of all eligible residents have had at least one dose, and 81% of all eligible residents are fully vaccinated. Our gains among first doses have been between 16 and 29, which is good. That's kind of where a lot of the cases are happening in that age. Well, with us, it's been spread out, but in general, you see in the state, going back up a couple slides, you see that in that 29 to 39 group tends to be a little bit higher for cases. That actually was a lot higher among the 29s earlier. Going back to us, it's good to see that age group. We're well vaccinated at the older age brackets. But it's good to see a little bit of an increase in there. School-based, schools are doing okay, doing fairly well since school opened with cases. So our cases have been spread out. There hasn't been more cases among younger kids. It's been relatively spread out among all age groups. As far as the vaccine, again, vaxfinder.mass.gov. The pharmacies are doing it. The Barnstable County Health Office does it once a week. Convenient MD has some community health center. Homebound, call the health department. If you have somebody who needs it needs to be done at home, well, you can use the VNA. They can grab doses and grab a dose and take care of homebound populations. So you can call the health department at 495-7485, and we can make that arrangement. Testing, still have the Test and Stay program. Convenient MD is a big player. CVS is as well. Falmouth Hospital with appointment from your physicians. The Fairgrounds still doing free testing Sunday and Thursdays from 4 to 6. And also, especially if you're a member of Community Health Center, you can also call them. But testing, I think we did 2,500 tests in the last 2 weeks, so that's an average of 1,250. So that's pretty robust amount of testing. So that's kind of where we are with testing. Talk a little bit about booster shots. There's been a little bit of change in the news. Actually, didn't fit on the slide. I apologize. I'm cut off there. But eligibility for a booster. Individuals who are immune compromised due to a particular health condition have been eligible for a booster dose of Pfizer or Moderna since August 13th. Pfizer recipients can get one after 6 months. Anyone over 65, residents of long-term care, people 50 to 64 with certain medical conditions, and 18 to 49 with another set of medical conditions, or anybody 18 to 64 who are in, have an occupation or an institutional setting such as healthcare, schools of that nature, can also get a booster if they'd like, if they've had Pfizer. You do want to get the same brand, so if you had Pfizer, stay with Pfizer. Moderna, you stay with Moderna. J&J. Now, J&J cannot get a booster at this time. They're still working on that, and that's one of the slide, the bullet point that got cut off. But yesterday on the news, it was an independent panel advised FDA to approve boosters for Moderna recipients 65 and older and all those that are at high risk. More information from the state will come from that. But that's, they did that. And J&J, they're meeting, I believe, today. That's what the bullet point below. I believe that same panel is going to be meeting today to start discussing J&J. So more information to come with that for those that have gotten Moderna or J&J. Again, to get it, going back up, your pharmacies right now, your best bet is if you want a booster to go that way. Again, Pfizer especially 6 months. Anybody who's had Pfizer, Moderna, if they're immune compromised. Again, you can make an appointment if you want on the Barnstable County Health Department site, but pharmacies right now, I believe, are going to be your best bet. We have, 2 CVS's, we have Osco and Shaw's, we have Stop and Shop, we have Walgreens as well. So, I mean, we have a lot of pharmacies in town, and, you can work with them. Just go on the Vax Finder and get on their website and go from there. As far as face coverings and other mandates, May 25th, again, this slide I haven't changed in a while, mask advisory and indoor public spaces is what we have at the town. The state wants unvaccinated, vaccinated with weakened immune systems, and definitely want masks for public transportation. That's still the state guidance. Schools require it to start the school year. CDC, in areas of high or substantial transmission, then things like mask mandates and other things to look at for mitigation need to be implemented. They also want you to look at your healthcare system capacity and vaccination rates. So this slide I have next shows you where Falmouth is. I made that line in the sand, so to speak, in yellow. That substantial would be an incidence rate of above 50. So again, to explain incidence rates, this is 14.4 is how many daily cases Falmouth would be getting if it had a population of 100,000 over the last couple of weeks. So we don't have a population of 100,000, so roughly about a third of that is what our actual case count per day is. But if you're hit an area where you're averaging 50 per 100,000, which was about 115 cases per week for us, that would be a substantial incident rate. We would jump into things like mask mandates and so forth. So that's the line in the sand based on the CDC. And also positivity, a greater than 8. We're at 2.88 in the low category for positivity. So at this point in time, then, we're, with the Board of Health and myself discussing it, we're going to follow the CDC's, and the line in the sand will be in areas of substantial or high. Hospitalizations, there's not an issue right now for hospitals' ability to service sick people with COVID, so that is a plus in our category for that. And also, vaccination rates are what they are. They're very robust for Falmouth compared to the rest of the country, especially the world. So we hit 2 out of 3 automatically, not automatically. We hit the vaccination automatically. As long as the hospitals are doing okay and we're not hitting, right up against that line of substantial, then we sort of stay the course is what we're looking to do. Obviously, we watch we look at all the cases and we can kind of make decisions. We can flip that switch when we need to. So that's what the metrics that we look at. Again, it's incident rate. How many cases are we getting? How much positivity are we getting with our tests, how the hospitals are doing it, how our vaccinations doing it is the way of which we've been doing this for further mitigation. As a recap, again, case count did increase from last week. There's 17 from last week and 48. Take that with a grain. It might have, I think a little more accurate would have been like 25 and 40, somewhere in there, but it just happened to be that we had a data dump come after I had posted it. So 17 was a little light, 48's a little heavy for the week. We're somewhere in between. We'll keep an eye on it. It just happens to be the way the data comes in. Sometimes the state does set in some older data just because things get lost, stuff happens through the reporting system before we get it, but it's just just happened to be the timing of it when we got them in. Our vaccination rates are good. Breakthrough does occur, but again, lower hospitalizations and definitely lower hospitalizations and deaths if you are vaccinated versus unvaccinated. A little bit about flu shots. Right now, pharmacies have flu shots available. We'll be posting it. So tentatively, I've just been working on this today, that the 11/9, we're looking at trying to do a 60+ at the senior center on 11/9, which will also have some high dose. Okay, so those over 65, I believe, are for high dose. And then 11/15, the following November the 15th, at the Gus Candy for 6 months and above. That's the one that we normally do. We're not going to do drive-through. We can do walk-in like we had been doing before. We did do the drive-through last year. We won't be doing a drive-through this year. It'll be a walk-in at the same place, the Gus Candy. It's like the one we usually did prior to COVID. We're going to ask for pre-registration. So you're going to pre-register through the health department next week. I'll post it on our website. So if keep an eye on our website. It's just as soon as I get it ready and I get the forms that the VNA wants to use, we'll post it, and then you can call and get registered for either one of those clinics. And if you need high dose, so we're just going to work out everything over by the weekend. Hopefully, have it all set up by Monday, Tuesday. You'll be able to register for these two clinics, and that way we can get a head count and an accurate number of how many vaccines we need to bring in. It's a little different from the old days. We used to just bring in 200 and about 150 automatically usually just came. I don't know what the demand is now. There tends to be more people that probably want the vaccines being in the forefront, for COVID. It's a little harder for us to sort of estimate how many people are going to show up to a clinic. So we like to sort of get a head count ahead of time. So we are asking you to call. It worked out fine last year with the drive-through. You'd called and we got your name and your information. We sent you the form, or had you get the form off our website so you can pre-fill it out. You show up with it filled out. The VNA, the person at the VNA looks at the paperwork, gives you your shot, you go home. So again, Gus Canty, we're looking to do one tentatively. I'll have the name formalized once I get everything all set, the dates and times. So we're looking at, I think the Gus Canty is going to be from like 3 to 6 on the 15th. And, the senior centers, I'm just working out the time with the senior center today to get a time. It's, normally we do these in October. I think it's good to do them in November. Sometimes you do them a little on the early side, and then, the vaccine wanes, but flu is still around in April, in early May. So this is when we're going to do them this year. Again, if you want one prior to that, pharmacies have plenty of them. So you can get it from them. So that's what we're going to do for a clinic. I'll post it all on our website next week. If you don't have internet access, don't worry. Give us a call midweek next week. Just call the health department, 508-495-7485. We'll have everything set up. We'll be able to register you without that. So we're not going to leave you behind because you don't have internet access. So you could just call the health department again, 508-495-7485. And we'll have it all, we'll have it ready for you guys to sign up and, whichever clinic you're looking for. So, and that's what I have for an update this week. And I will talk to everybody next Friday.